Hi, I'm Dr. Vonda Wright, and this is Hot for Your Health. Join us for conversations on the bleeding edge of science, health, and culture as we bring you tech innovators, thought leaders, and the movers and shakers who are transforming science fiction into your new health reality. Hi, everyone. This is Dr. Vonda Wright, and I'm excited for another time with you on Hot for Your Health. You know, it's amazing who we meet throughout our careers and in all the different places. And my next guest, Dr. Sue Varma, I have known for quite a few years through work with media and work with a company uh, called Share Care. And then only recently did we get to meet in person, despite the fact that I've talked to her many times historically. Dr. Varma is one of the nation's foremost mental health authorities, and she is truly a multi-dimensional expert dealing in everything from strict MD psychiatry to setting up programs after 9/11 for big hospitals in New York, as well as serving as a media expert, which means she takes all the information that she's assimilated throughout her education and caring for thousands of patients and translates it into everyday language that we all can understand. And so I'm really excited to have you here today, especially because you just put out this amazing book, Practical Optimism. And as I was reading through it and listening to the quotes and hearing stories about your family and your father, who was also a doctor, I just think we have a lot to talk about today.
Thank you so much for such a warm welcome. And ditto, I have that admiration and respect for everything you do and just keeping us healthy and wise and all the tips. So I'm excited to get into it. And I love that you have a little surgical tool attached to the book and the note card.
Listen,
It's through Dr. Vonda.
for those of you who aren't watching this on YouTube, go watch it. But I have a needle driver marking the page with the pillars of this book.
I love it. Thank you.
Well, but before we get into practical optimism, um, which I'm sure is, when I write, it's such a labor of love. It's the dumping of out of our brains of all our life experiences. And you know what? I want to go literally way back to some of your early work because I remember 9/11 like people who remember John F. Kennedy's assassination. I remember where I was, what I was doing. I was sitting on the bed of one of my trauma patients, and he's like, "Watch this news with me." And I thought it was a fake movie until we watched the second tower come down. So I would really, really like to understand your work with the 9/11 mental health program at NYU and how that really you can't have gone through that without it changing your whole worldview and perspective. So tell us a story about that, or tell us what you developed.
Yes, absolutely. So, on 9/11 itself, I was a medical student and I was on a pediatric rotator and we were working in a New York City hospital. And I remember seeing we had come in at 5 a.m. So this is several hours later into our day that we're watching the events unfold on TV in a patient's room. And then getting the orders that discharge, discharge, discharge. We want to create beds in the hospital. We're going to get tons of patients. And we did. Anybody that was well enough to go home, even though it was a pediatric unit, we were expecting that there would be adults on the floor or children or anybody in the area. And we waited and we waited and we waited. And we simply didn't see the number of people when he came. And that's because the death toll was so high. And, so many of us volunteered in the weeks afterwards. My husband at the time was also a medical student and he volunteered at the morgue, at the coroner's office, and, just trying to help in any way that we could. I ended up getting trauma training and I didn't know where this was going to lead or how this was going to impact me career-wise. But I just know that, people whether you lived in New York City or not, or any of the affected areas, I think people all over the country and all over the world in some way felt impacted by this. And that's what, mass disasters and specifically terrorism does, is that it's meant to chip away at your morale, at your sense of safety, at your sense of trust in other people. And the irony is that, we really saw both the depths of depravity in this situation, but we also saw the heights of humanity. And this concept of, quote, New York strong really comes from that people come together, and years later, I would be recruited for this role of medical director of the 9/11 mental health program. And it was a new program. And it was just amazing to see how people came together to help one another, whether it was that day, so I would meet patients who were evacuated and caught in the dust, the cloud, and the rubble, who had seen people jump out the window, who had lost colleagues. I remember, family members that day, we didn't know where they were, and you couldn't get in touch with anyone through cell phone, like you couldn't, and not knowing where your loved ones were or friends, and us all having lost people that we knew that day. So there is no coming back. I realized that you end up that one person that you were. Anytime there's a trauma, whether it's personal, whether it's public, it changes you. And there is one person, I always say, lovingly, even with the pandemic, and that was almost 20 years later, when I think of the two most defining periods in my life, at least, or in adulthood, it was, 9/11, and then 20 years later, the pandemic. I lovingly say BC, like before COVID,
Yes.
and then after, right? There's one person. So, and what's really interesting is that studies show that after the pandemic, different topic, but just to use it as a, insert trauma here, almost people's personalities change. And usually people's personalities in adulthood really don't change. And if it does, it's over the course of maybe a decade. And we saw these accelerated changes in people's worldview of safety, of trust, or maybe the opposite, right? Of coming together, of resilience, of strengthening of bonds. But anytime there's a trauma, many things happen, right? The chipping away of the morale. Sometimes if you're an adolescent, you kind of become stunted in some ways if you're not able to process the grief or the loss or make sense. Meaning making, and that's an essential part of what is now known as post-traumatic growth. So I saw a lot of things. I think my worldview changed in the sense that, oh my God, these are things I only would have seen in a movie. My brain couldn't comprehend that all of these factors that had to align for this devastation to happen. And, it just felt completely like out of body experience, very, very unreal. But, fast forwarding a few years, when I then finished medical school, finished residency, and my first job is being recruited for this role, there's a lot of fear and trepidation of, oh my God, who am I? Yes, I've got training behind me, but to take on such a big role. And, Vonda, you and I were talking about this big conference that happened last week. And it was interesting because it was about practical optimism in the workplace. And, many of us are taking on roles that there's imposter syndrome that comes to the table. And I remember thinking that even if I've had all this training, how does one ever prepare for devastation on this level, right? Like this is the biggest kind of trauma that we saw on US soil. And I remember walking in the first day to work, and, they're telling me everything that's involved. And they're like, okay, this role involves communicating with government officials and the mayor's office and community coalitions. And there's policies and procedures that need to be put in place. And there's 1,000-person wait list because this involves treating both civilians and first responders. And I was like, great. How many psychiatrists do we have? 5, 10? Who's coming on board? And they're like, no, it's just you.
Oh my gosh. Welcome to your job.
I was like, are you kidding me? And I was like, well, big shoes to fill. And they're like, no, 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 there are no shoes. It's a new role. And so they're like, you're bringing your own shoes. And I was like, oh, great. I got big feet. I got size 9 and on a good day. So it was just the biggest learning experience. But, it's so interesting that here I am seeing death and devastation around me in New York City with colleagues, with friends, and with patients, and then writing a book about optimism. And it seems like that would be the last thing in the world. It's like, Sue, how have you not lost your faith in humanity, right? But I have to say that seeing what I saw with my patients, they restored my faith back in humanity. When I saw that, there was this one patient in particular, and I talk about her in the book, Teresa, who is this 68-year-old woman. She's working in the accounting office. She's been working in the towers for 20 years. And she escapes the North Tower and like just like everyone else got trampled on, lost people that day. And for some reason, Teresa never meets the criteria to come into our mental health program. So she has seen the death and the devastation. She's coming in for medical monitoring of GI symptoms and asthma, and many patients have gotten cancer, but she doesn't screen positive for anxiety, for depression, um, and for substance abuse. And I asked her, in Spanish, I said, Teresa, ¿cuál es su secreto? And she says, mi propósito, my purpose. And it touched me because here she was coming as a volunteer in community coalition meetings, fighting for people's rights to be able to get, a compensation or just health benefits, coming with people who are agoraphobic, who are scared to leave the house. Many people couldn't take trains or public transportation. They were afraid of what would happen to them, that there would be another terrorist attack. And she came always helping people and in the way that she didn't have to. And so I realized that altruism, and later on we would learn through the studies that altruism is a key component of resilience, and so is optimism. But nobody would study optimism because it was seen as like woo-woo, touchy-feely, no science, no evidence behind it. And it was something that you were either born with or not, right? And so it was just like a dead concept. It was there. We knew that it was a part of resilience. But what I later found out is that resilience is good, right? Resilience is bouncing back in the face of adversity, right? But optimism, and practical optimism specifically, is about thriving in the face of it. So none of us are going to get through life without adversity, right? But we don't want to just bounce back, because what are you bouncing back to, right? Person you were yesterday before the trauma doesn't exist anymore. And maybe you don't want to go back to your baseline, because maybe your baseline is what got you here in the first place, right? The anxiety and the depression, because maybe, you weren't having friends as much, or you didn't really have a job that you loved, or you're having trouble with your spouse. So really, I think of downfalls as an opportunity to reassess and recalibrate, and a lot of times when patients come to me, my role, we were talking about allopathic Western medicine up till this point, is just taking people from dysfunctional to functional, right? And that is in itself a great thing to do when we go to see a physician, right? But I realize I don't want to stop there. To me, that seems only part of the process. I want to take them from functional to optimal. And that's where the practical optimism and optimism comes, is harnessing the benefits, the scientific benefits, whether it's exceptional longevity. We know that optimists live 15% longer, and not just longer, but in good health. And we want health span, not necessarily lifespan. We want to live longer. And we know, and I know this is your area of expertise, that most women were living the last decade of life in poor health with dementia, cognitive decline. So to really see the health, head to toe health benefits, anxiety, depression, decrease, less incidence of stroke and heart attack in optimists, then recognizing that we can teach people how to be optimistic, right? And that was where my mind exploded. I was like, oh my God, I'm already doing so many of these things with my patients. Problem is, these patients won't come in to see me until the other shoe drops. And we know that most people won't go to a therapist. 2/3 of people are either never going to be diagnosed with a mental illness or mental health disorder, even though we know that 1 out of 5 people will experience it. And those that do may not necessarily have access to care, even if they get diagnosed. So I wanted to put something that can be a bridge, a program between illness and prevention, right? So sickness and wellness, right? And also using a strengths-based model, because so much of our care, we shouldn't really call it health care, we should call it sick care, because you don't see a doctor until you're sick. So marrying these two ideas of prevention and treatment, illness and wellness, because if you don't take care of your wellness, it will become your illness. And knowing that some people will never get help. So how do we give people tools and techniques so that they can reclaim agency? So in the face of disaster, and it doesn't have to be big D, big, big like T, big trauma, little trauma every day. So how can you help yourself? So that is a mouthful, Vonda, but that gives you the background
No.
of how I got here.
Well, and I love that whole explanation and how you've taken. I just think about, I mean, I have so many memories of that day because I was in Pittsburgh, so flight 93. I had the same experience. The hospital was shut down. We went into emergency mode. We waited for the people. They never came, right? But my experience was, because, and I'm drawing it back to what you said. Sometimes you get stuck in that place where the biggest trauma was, and you have to work through it to be successful. Because I had another thought as you were talking, but I don't think I'm alone in for maybe a decade, maybe 15 years after that happened, every 9/11, I would have to call my girlfriend who was who was living near ground zero, and just hearing her voice, we would be weeping, and that is part of living growing through that trauma and learning from it,
Hmm.
because I realize that you cannot, exactly what you're just saying, you cannot live through big traumas, whether, of course, capital D disaster, little disasters, for some people, it's a little divorce or a life trauma, right? Without being changed, and then just recognizing that that is a growth opportunity and that you can learn to be practically optimistic. And you start out your book, a pessimist complains about the wind, right? You're just going to observe the wind and have nothing good to say about it. An optimist expects the winds to change just passively. But a practical optimist, you say, takes action, exerts agency, adjusts the sails. And so I love that you've captured that, because I believe that confidence is our memory of successes. And when you change the sails,
Hmm.
am I getting this right? Am I understanding
Absolutely.
your concepts?
No, 100%. And I'm so glad you brought that up because, a lot of times people say, oh, this is woo woo, it's toxic positivity. And I say, the difference is that in toxic positivity, you're telling someone to just look on the bright side and just get over it without understanding and validating the depths and the gravity of what they've been through, right? And that is not what optimism is. And that's not what practical optimism is, right? Optimism is simply the ability to see things, the cup as half full, right? But practical optimism goes one step further and it says that I want to turn these positive outlooks into positive outcomes through action. And that is what practical optimism is that it is a practice. So it is like learning a new language, a skill set, learning to ride a bike, playing a musical instrument, learning a new sport. Some days it's a 5-minute practice and some days it's longer. When I say that it's a choice, and there's another quote that I've shared in that book is that, there's a quote that's sometimes attributed to Martin Luther King, and it says, even if I knew that tomorrow the world would fall to pieces, I would still plant my apple tree. So it is very much looking at adversity in the face, in its eye, and it says, I see you, but I'm going to remain undeterred, right? I have to do what I have to do. And so, I love that you're bringing up the fact that there's extremes on both sides. And people say, well, okay, tell me, like, what does this look like in real life? So, like, let's say that it's time for your annual visit. The pessimist may say, oh my God, and I have a lot of patients with health anxiety who are like, and by the way, I just got my mammogram yesterday, all good. But like, there's all this anxiety leading up to what am I going to find out? Oh my God, is this going to be the year? Because I have so many friends in my circle who have been touched by it. My mom had breast cancer. So, the pessimist and I have patients who are like, I'm not going to my annual visit. I don't want to hear the bad news and I can't handle the bad news. That's one extreme. They remain passive and paralyzed by negativity. The extreme pessimist, the extreme optimist, on the other hand, they are in denial. I don't need an annual visit. I'm fine. I don't have a history of cancer. Everything, it's all good, right? Or if the doctor has said, yeah, that you've got, there's a little things I'm a little worried about. You're on the cusp of, there's some hemoglobin A1C, you're pre-diabetic. I don't like it. Your cholesterol, your LDL is a little bit high. The extreme optimist may think that everything will work itself out. So it's called blind optimism or the ostrich effect, where you bury your head in the sand, yeah, and you put these blinders on, you're like, everything will be fine. And the reality is that not all optimism is good and not all pessimism is bad. And we find that pessimists, in small doses, healthy skepticism can be healthy because you do your due diligence, you do your research, you do your homework. The problem is that pessimists in the extreme form become mired with negativity and they don't act. So what you want, there's a joke, if you want accuracy, go to the pessimist. If you want the job done, go to the practical optimist, right? Who's done the homework but very quickly has to act. So, when people are deliberating, and I talk about this in the book, maximizers, these are people who, I joked that my mom was a maximizer when I remember shopping for a car with her and my dad. And she was like, oh, but what is the horsepower? And is there a moonroof? And I'm like, Mom, do you need a moonroof? Like, are you like, yeah. Is this like a convertible where you're sticking your head out with your girlfriend? It's like, why do you care? She's like, I just want to make sure that we're getting like a good value. And I'm like, Mom, what do you need to focus on? Whereas my dad would be like, good, like good is good enough, right? Like perfect is the enemy of the good. Those are satisficers. It's like this word, two words combined, but it's just like, we need to get the job done. So I always say, if you have a small to medium decision, not life changing, take 3 days, whatever, 3 weeks, you pick a number, right? 3 people ask, and then make a decision and move forward. So that is where healthy skepticism can be brought in, do my due diligence, but then I'm going to use the information to move forward.
Well, something I like about your framework for practical optimism, and you have 8 pillars in the book, and I want to go over a few of them. Not all 8, because I want people to go buy your book. But part of what I love about the whole concept is, as a surgeon, there are certain places in my life, like the OR, where I am a complete absurd control freak, because I have to be to keep people safe. But what practical optimism allows us, and I just said it, but it's so important to me, and it's so important I've discovered in the concepts of resilience and hardiness, is agency. We are not frozen
Mhm.
like a pessimist. We are not debating every single option like a blind optimist, but a practical optimist, which I'm going to wear that as my new tag, is I get to vet, I get to observe that changes can happen, and then I get to make the change as a
Mhm.
practical optimist, right? Everything is changeable. We can take the steps, but it starts with purpose. Pillar
Yeah.
1 for 1 in your book is knowing purpose, like where you're going. Is that what that
Yeah.
means?
Yes, absolutely. And it could be capital P purpose in life, right? Or it could just be small. What is my purpose this day with this person in this conversation? What is it that I want to be able to communicate? And it could be in very circumscribed situations. So I always say that there's ways to boost purpose. Number one, I say your purpose yesterday doesn't have to be the same as your purpose today. Purpose today doesn't have to be the same as purpose tomorrow. Our purpose is always evolving just as we are. So give yourself some grace if you're like, I don't know, I want to pivot. I don't have to have it all figured out. And they've done studies and they're showing that in young people, one of the biggest pressures that they're feeling these days is that they feel like they have to figure it all out. And I was like, oh, geez, we as adults feel that. Now it's just getting younger and younger. The other thing is that if you can't find your purpose, it's your job to create it by putting the cart before the horse and starting to populate your calendar with activities that give you pleasure, meaning, and joy. And it's really important because I talk about my own blind spots in that I was raised in a family environment of educators, doctors, where our purpose was in service of other people, right? So I grew up, and this word dharma in Sanskrit is purpose and duty and obligation, really in service of others. And so I was ingrained with this, infused with these ideas, but I never learned how to self-care. And so that was left up to me, the play, the joy, the fun, right? And I was almost raised to think that not that it was frivolous, but that it was somehow less important, right? If you weren't doing big things in service of other people. So purpose should be and can be for other people. And there's a lot of value and benefit, health benefits, volunteering 2 hours a week, having a strong sense of purpose. In the next 8.5 years in this one study, you show less mortality, people have less heart attacks, all causes, they're dying less. Like you have to not forget the play part, right? Because otherwise we're always balancing drudgery with joy, right? So too much purpose in service of other people is going to really be drudgery, and too much fun and play can feel empty. So we want to balance both of those. But I say when it comes to purpose, write your purpose in pen and your path in pencil, right? So what I mean by that is be firm in your purpose. What do I want to do? I want to help people, right? But how you do that, be flexible in your path. Because a lot of people may say, let's say a young person is like, I can only help people and I have to become a doctor. Okay, but that involves, I don't know, 12 to 16 years of studying and sacrifice and MCATs. And it's not everyone's cup of tea, but you can make a difference where you are in any way that you want. It doesn't have to be this one and only way. So be flexible with that.
And I love the comment you made. Sometimes you have to put the cart before the horse, because we can be paralyzed by not even, it takes a lot of self-reflection to know how you what you want your purpose to be, whether it's service. And so You could ruminate on that for years. I don't know what it is versus you just said populate your calendar, just do some action and it will become more clear.
Yes, exactly. And then, and this Japanese concept of ikigai, it just really speaks to me because it's this confluence of like mission, vocation, like what are you passionate about? What does the world need? Who is paying you for it? And like ideally, who of these match up, right? Not everything has to match up. But if you and so many people say that like, oh, I need to turn my side hustle, my passion, let's say it's decorating or whatever it is, like you're good at in some creative form, photography. It doesn't have to be your main job. And so your purpose does not have to come from your paycheck. Your purpose does not have to be glamorous. No one else in the world has to understand your purpose, right? So I'm giving people permission to let go of it has to be big and fabulous. And if it's not, then I'm not going to do it. And I think I suffer from that because the idea of, oh, I'm going to spend years and years and years doing something that's not going to resonate with people, right? But it's like, that's way too much pressure to put on yourself. So I say, do it for you, even if it's like writing a couple of sentences that make you feel creative. It doesn't have to turn into a book. Like not everything has to be a means to an end. It can be an end unto itself.
I love that. It takes the pressure off. It allows grace, as you've said. So we identify our purpose, whether it's an overarching life goal or today's purpose. And then the next step you say is that you have to deepen your emotional wisdom and awareness by processing your emotions. I think that's hard because some days we're just going through the motions. We have a routine. We just don't let any of those things out. How do we process our emotions and build more awareness so that we can progress?
Mhm. So the first thing is just recognizing that there's value to realizing it. I think a lot of people look at emotions as inconvenience, and even when we look at literature, like French literature, the word emotion meant like stirring, but like not in a good way. Like this is problem stirring. I want to stifle them. And we found that it actually takes more mental and physical energy to suppress emotions than it does to release them. And so if you realize that your immune system is going to be boosted, you're going to have less coughs and colds and headaches and tension and problems and stress simply by journaling. You don't even have to tell anyone about what you're experiencing. That just 2 10-minute journaling sessions a week has had all of these health benefits that I mentioned. And a quick way that I tell people to help process emotions, it's a 4-step plan, and it's called name it, claim it, tame it, and reframe it. So name the antecedent, right? So if you're like feeling really like, something is really making me upset and I just can't figure it out, what has happened? Go back in your day, go back in your week, right? Who said what to you, right? Was it a colleague, a boss? Maybe someone didn't respond to your email. Maybe you were asking for a promotion and that's weighing on you. So name the antecedent, claim it. Where in the body are you experiencing it? Are you experiencing headaches, tensions? Are you having frequent urination, insomnia? How is it manifesting physically? Because the body will express what the mind cannot. And then how are you going to tame it? Do you have any self-soothing habits that are healthy, right? So healthy coping mechanisms. So this is not endless hours of binge watching. It's maybe watching one thing that's mindless and funny, or scrolling, but not endless, not doom scrolling, a couple of funny cat videos or memes or whatever. Or is it going to be a 1-minute meditation, right? And so there's something I call creating oasis moments. And these are just moments of silence. It could be making a little Zen den in your home, a little pillow, a little throw blanket, just a moment in your home. And it could be 1 minute. It could be at your desk. I say that like when I was in training, it would have been a utility closet. I'll be like, oh, I'm going to go get the tourniquet and then the needles and I'll be right back. And then, yeah, just do some deep breathing. Yeah. And then reframing it. You could even do it in a parking lot, the deep breathing. And then reframing, this is the most powerful, and this is the work that came out of working with survivors of trauma is there any way to reframe the situation? And I say, if there is, and first of all, I put the disclaimer, you're not always going to be able to reframe it, anything in a positive. There are going to be some things that you're like, no, I'm sorry. There is literally no silver lining to what happened here, right? The death and devastation, I can't find that. And I'm totally okay with it. But in the more day-to-day things that happen, asking yourself, what would I tell a friend? Because we're all often more kinder and gentler and compassionate with other people. And how would I look at this 5 years from now? And then I say, if you can't find a silver lining, ask yourself, is this a problem to be solved or a truth to be accepted? Right? Like, is this a problem to be solved or a truth to be accepted? Because sometimes there is nothing that we can do except sit with these powerful emotions or even losses, right? Like it's very hard. You lose a loved one. There is sometimes no silver lining in it, right?
Yeah.
There's acceptance, and acceptance takes time. And so to give yourself grace, one thing I learned, I remember after my mom had passed, I went to see a therapist and she said to me, Sue, when is the last time you just gave yourself a day off? Because I literally, like, after she passed, went right back to work. And I was like, I couldn't take time off for my patients. Like, I felt a certain level of duty and responsibility. I remember asking the therapist a funny question. I'm like, take time off to do what? She's like, nothing. Take a nap. Like, how about you just lay in your bed? And I was like, oh, there's an idea. Lay in my bed. Like, I have 2 young kids. I don't have time to, like, and I have a busy job. Like,
Laying like that.
yeah, like, but it was freeing because I felt like I needed permission from, like, an authority figure, because I was raised with this mentality of you must at least have something to show for your time, right? So we all have scripts and conditioning that we were raised in. That's mine, and they're sometimes maladaptive. And so you have to say, is this old way of thinking that might have served me to be productive and successful and achievement oriented in one aspect of my life, how is it now deterring me as an adult where I get to call the shots? So it was very freeing to have that conversation and to be like, yeah, you can do nothing. Like, give yourself grace.
What a gift.
Yeah.
That session was a gift.
Yes,
right?
absolutely. Absolutely. And I struggle, I think, and I'm very open about, like, sometimes there are things that are works in progress, and I say, like, I'm very hard on myself. And so for me, the chapter on self-compassion and pride, which, pride may seem arrogant, but it's really having an intrinsic sense of self-worth and saying, like, I deserve rest simply because I'm human. I don't have to earn it. Right. And that's something that I've had to really come back to a lot in my life.
Yeah. So important. We are worth that.
Yes.
Yeah.
Yes.
Well, in the last few minutes that we're talking, I'm skipping pillars. I want to talk about the pillar of proficiency, because sometimes we may be able to identify our purpose. We may do the really hard work of processing emotions and then problem solving, but sometimes we just don't feel equipped. And those learning skills, whether it's resilient skills, or what did you mean by proficiency? I don't want to put words in your mouth.
Yeah. Yeah.
That's been critical for me. When I don't know how to do something, I go figure it out.
Yes, yes. And the key here is, like, you don't have to figure it out all by yourself. And I think a lot of us feel as if we need to figure it out. And the beauty that the proficiency is this idea of self-efficacy, and the confidence in your abilities are just as important, if not slightly more, than your actual abilities. And it's like, I'm not saying fake it till you make it, right? I'm saying you you have to have the confidence to believe that it can be done, right? And even if it's not just alone. And this is based on the work of Albert Bandura, and he looked at ways that people can boost their sense of confidence and agency. And there's a few ways. One is by getting mentorship. The other one is by vicarious learning. So I'm just thinking of all the residents and fellows that have shadowed you over the years, right? Like, watching you, who do they look up to you, and they're like, how is she doing it? She's our role model. But at the end of the day, doing it yourself is, like we learned in medical school, see one, do one, teach one. Doing it yourself is the best way, and getting feedback. And I think being open to feedback, because that's really, really hard for a lot of people. And so finding somebody, what this looks like in the work arena is that maybe it's not going to be your boss that is in charge of your compensation. Because a lot of people say, I'm afraid to appear vulnerable to the same person that is deciding my compensation, in which case looking for mentorship, maybe outside of the department, outside of the organization, is really key. But, I have a quote in there by Rumi, and he says, don't let rest upon others and their stories. Go out and unfold your own mix. So at the end of the day, learn from other people, but do it yourself at the end.
And have grace to know that as you're building your proficiency, it doesn't mean perfection, right? Because that itself is a barrier.
Yes. And that's a problem with so many people I know, myself included. We sometimes don't take risks. We don't act because we feel as if we have to come out of the gate with everything perfect. And, it's interesting. One of my patients is a young therapist in training. And she asked me, Dr. Varma, I know you've been doing this for some time. Do you ever get to a point where you feel like, I'm good, I know everything, And I said, I don't know about knowing everything, but you certainly get to a point where you feel experienced. And I think what comes with experience is the confidence to be able to figure it out. And that's what you said, if I don't know something. So that to me is what comes. Like, so yes, I do feel like most things I can handle. Like, if there's a complicated situation with a patient, I know but I also know that I can ask for help and I can have options. And so just knowing that, but you have to do it yourself, like that resilience comes with, I'll figure it out because I have figured it. And I love the way that you said about confidence comes from remembering successes and really mastery. And that's also one of the things I talk about in the book is you don't have to be a master to experience mastery, but it is your job to give yourself the opportunity to get better at something. And it doesn't have to be big. It could be gardening, it could be pottery, it could be cooking. But I really do think that happiness exists in flow state, because flow states from a neuroscience point of view are incompatible with rumination. And we know that norepinephrine and dopamine are elevated during those times. And really it shuts off what's called the brain's default mode network. And that's what's happening in your brain when you're not doing anything, when you're kind of idle and scanning and then end up ruminating. So spend 15 to 20 minutes a week learning to be better at something. And it's this delicate balance between choosing something that's just slightly challenging enough so that you don't get frustrated, but not so easy that you become bored. So it's a sweet spot. It's almost like this inverted U-shaped curve that the harder something gets, like at first, we'll have peak performance at a certain point, but then too hard and you become frustrated and you lose the attention and lose the focus.
Yeah. I love that concept because, I've been doing this job of mine, this life of mine, a very long time, but there is that growth. I'm just reflecting on myself that comes from learning something new almost every day. But I totally identify with the joy that comes from not ruminating, but entering into a flow state. In surgery, for instance, some days to my patients, I always do an amazing job for you, but some days are better than others. But when I am in surgery and I enter a flow state and then I leave the OR and I just have that satisfaction that, gosh, I learned something in 25 years. I am really good at this. I just helped. There is that joy that comes from, I hope I'm not getting off track, but I was just reflecting on what you're
Yes.
saying about
Yes.
learned and how that, and every day progressing and learning something.
Mhm.
Yeah.
Yes. Yeah. And also learning something and putting ourselves, I'm just thinking about the work that we do that's like outside of the clinical setting. And it's fascinating because I feel like it allows for creative expression, right? And we're constantly tapping into different markets with different audiences, with different people, with different backgrounds, and in the speaking work. And, so I feel like, when I think of happiness, I think curiosity and creativity are key components.
That's
Yeah.
right.
And just continuing to grow and learn and putting yourself outside your comfort zone, and that means for me, like being outside of an academic setting, so it's just interesting. And then being able to interact and intersect with people and specialists outside of the day-to-day work. So I feel like that's where I'll never get bored because meeting, great accomplished people, talking to people like you. And I feel like that there's commonality that even though we're in completely different professions, there's intersection in this sort of public sphere. And I just want to encourage people that no matter what you do, don't be afraid to dabble in new things. You don't have to be the expert in everything.
Yeah. I love that. And that is perfect because what you've just called people to is to be brave, right? Just, or courageous even. So I love that. Well, I think you and I could talk forever. I think you and I should hang out next time I'm in New York. But
Absolutely. I would love that.
Dr. Sue Varma, the so many things, but author of Practical Optimism. I'm going to have some of my children read this. I think that there's just so much to be learned from this book. I mean, no matter what your age, I've learned a lot from it, but even in my teenagers. So thank you so much for this and your time today.
Thank you so much. What a pleasure. I so enjoyed this. And please do let me know when you're back in New York.
I will.
I'm Dr. Vonda Wright. See you next week.